Listen, do you hear the sound of high blood pressure? Today we're going to present our research which was based on the correlation that abnormal blood pressure holds to heart diseases. My name is Abril Valadez,
And I'm Jada Vaughn.
and our main question here was to determine whether hypertension is one of the leading factors to cause heart diseases. We will be answering questions should you have them.
To begin with, we have our abstract. The role of hypertension has been scientifically proven to be correlated with heart diseases such as cardiovascular disease. Two students from the Science, Technology, Engineering, and Mathematics program at Laredo College gathered the necessary information to determine whether an abnormal blood pressure correlates to heart disease. Our hypothesis is that there is a correlation between hypertension and heart disease. The research team reviewed articles, answered surveys, and gathered data to test their hypothesis during fall 2020 and spring 2021. The reason why this type of research was conducted was to bring awareness to our community, especially because statistics show that Latinos have the highest percent of people with hypertension than any other ethnicity. The results of the trial all concluded that with a healthier lifestyle, there is a decrease in numbers of cardiovascular diseases, strokes, and kidney diseases. The results were to be expected for the simple fact that as the blood pressure goes up, our body reacts in a negative way, causing multiple diseases if left untreated.
Moving on to our left middle side, we have our introduction/background. The purpose of the study was to bring awareness of the risk of having hypertension, especially in Laredo, Texas, since the majority of the population are Hispanics. This section gave a little information about the cardiovascular system and what are the blood pressure ranges. The cardiovascular system includes organs such as the heart, arteries, capillaries, and veins. The systolic number indicates how much pressure the blood applies against the artery walls when beating, and the diastolic number indicates how much pressure the blood is applying against the artery when resting between beats. Previous research articles such as blood pressure targets, how low should it go and for whom, have discussed that a normal blood pressure reading is around 120 over 80. Anything around 130 over 90 would already be classified as hypertension. Why our hypothesis turned out to be right, Jade and I participated to gather the proper information needed for the study by gathering 30 patients and taking their vital signs such as their blood pressure and pulse pressure. Moving on to our right side, we have our material and methods. Our first illustration shows the materials that we used, which include the a stethoscope, a blood pressure cuff, and a sphygmomanometer and disinfecting wipes. The second illustration shows how we explain the procedure to each of the volunteers before and after beginning the procedure. Illustration 3 shows how we sanitize before and after, using it for each of our patients. And illustration number 4 and 5 show how we did the procedure of taking the blood pressure.
Moving on to the middle of our poster, on the left-hand side, we do have the results of the female blood pressure and pulse pressure. Following under that, we have the male body mass index. On the right-hand side, we have the male blood pressure and pulse pressure. And following that, we have the female body mass index as well.
Moving on to our conclusion, like mentioned before in the introduction, Jada and I gathered blood pressure, heart rate, the BMI, the height, and weight from relatives to gather more information and prove our hypothesis. The participants read that the higher BMI, the higher the blood pressure. This indicates that our hypothesis was right. People who are overweight are more prone to hypertension and heart diseases. This is because the body has more fat in it. The heart has to work double to get the blood pumping throughout the body. All in all, it is important to inform people about the risk of having hypertension because it can lead to life-threatening conditions. High blood pressure can often be prevented or treated by eating a healthy diet and exercising.
Moving on to our discussion, the majority of male participants were within the normal range of BMI, resulting only with one being overweight, one being obese, and four being underweight. It is important that the males maintain a healthy weight to reduce and prevent future health risks and diseases. In addition, female BMI results indicated that the highest BMI among our participants was a total of 30.4. A really high BMI could result in a higher risk for cardiovascular disease. If the BMI is high, chances are that the blood pressure will be high. The systolic blood pressure for all female participants were in the range of 120 millimeters Hg. Half of the 19 of the female participants had a regular systolic pressure, and 2 of them had an abnormal reading. The diastolic reading for female participants were in the range of 82 mmHg. Nine of them had an abnormal reading. The diastolic reading for the females. Oh, I messed up. I'm sorry. The pulse pressure for the females was at the range of 33 Hg, which is considered normal. Moving on to our acknowledgements, we would like to thank Dr. Nora Garza, Vice President for Resource Development and External Affairs, Department of Resource Development at Laredo College. Ms. Rosemary Agüero Riojas, LEAPS Project Director, Department of Resource Development, Laredo College. Our 2 mentors, Sabrina Rios and Kathleen Chavez, Research Student Mentor at Laredo College as well. Dr. De La Torre, Department of Natural Science, Laredo College. Gabriela Solis Cavazos, Undergraduate Research Coordinator, Department of Resource Development at Laredo College, and funded by Hispanic Serving Institute, Title III STEM.
In our left bottom side, we have our references that we use to conduct our research. All in all, the poster included our whole research. After reading various articles and gathering data from our relatives, it turned out that our hypothesis was correct. Hypertension does correlate with heart diseases. As mentioned before, the BMI of a person has a lot to do with the blood pressure. This study serves as a reminder for people to be more cautious with how we manage our lifestyle. With a healthier and active lifestyle, the risk of hypertension and heart diseases reduces. Thank you all for taking time out of your busy schedules to listen to our presentation. If you all have any question, we will be answering them.